Mr. Speaker, 2 weeks ago, this Republican leadership brought to the floor a budget resolution that paves the way toward repealing the Affordable Care Act and taking health care away from millions and millions of American families. Repealing the Affordable Care Act would cause over 30 million Americans to lose coverage and millions to see an increase in health care costs. It would deny those with pre-existing conditions access to quality health insurance. It would do away with Medicaid expansion, which is working to cover the most vulnerable people in 31 states and the District of Columbia. It would once again put insurance companies back in charge of our health care. Repealing the Affordable Care Act would also have a detrimental effect on efforts to end hunger in our communities. Not only do we have a moral imperative to address food insecurity, but we have a financial incentive as well. Health costs attributable to hunger have been estimated at $160 billion annually. As Catherine D'Amato, President and CEO of the Greater Boston Food Bank, pointed out in a recent piece in the Boston Globe, the community health needs assessments now required by the Affordable Care Act have led health centers across the country, from Massachusetts to Oregon, to develop partnerships with local food banks to address the food insecurity revealed in their assessments. I'm proud Massachusetts has been a leader in addressing food insecurity and in treating hunger as the public health issue it is. Across the Commonwealth, health centers have used the Community Health Needs Assessment to identify challenges in accessing healthy foods for vulnerable populations. UMass Memorial Medical Center, located in my hometown of Worcester, has identified access to healthy food as a community health need in its 2 most recent community health need assessments. In response to the findings, UMass Memorial worked with the City of Worcester and the Regional Environmental Council to establish an urban agricultural program within an underserved area of the city. The program employs kids from the neighborhood and teaches them how to grow produce. The Veggie Mobile Farmers Market then distributes the local produce to neighbors in food deserts across the city. Residents using SNAP dollars are given extra incentive to purchase the nutritious vegetables from these sites in the form of double up bucks. They receive $2 worth of produce for every dollar spent. The assessments have also led to the creation of another community garden project within a public housing development and the creation of a backyard gardening program that teaches local residents how to grow food and eat healthy. The Worcester County Food Bank has worked to sustain and expand these urban agriculture and anti-hunger measures in the City of Worcester and has formed the Worcester Food Policy Council to support these efforts. In Western Massachusetts, the Community Health Needs Assessment is having similar results. A 2013 Community Health Needs Assessment conducted by Holyoke Medical Center identified uncertainty in food access and the presence of food deserts as 2 priority areas that need to be addressed to improve community health. In response to these findings and in recognition that hunger is a serious health challenge among residents in Western Massachusetts, 24 organizations formed the region's task force to end hunger. Out of this effort came a collaboration between the Food Bank of Western Massachusetts, Holyoke Health Center, and other stakeholders to establish an innovative pilot that will connect food insecure pediatric patients and their families with nutrition and other social services. The Holyoke Health Center will institute pediatric food insecurity screenings, and hungry families will be referred to the food bank for food assistance, including connections to food pantries and meal sites in their neighborhoods, nutrition education, and for help in applying for SNAP benefits. These families will also be referred to specific social service providers for other resources like stable housing, financial literacy, employment services, and much, much more. And in the Boston area, as Mr. D'Amato pointed out in the Boston Globe, the Greater Boston Food Bank is partnering with community health centers to screen for food insecurity in their patients, provide toolkits of available food assistance and resources for families, and operate free mobile markets that distribute fresh fruits and vegetables to hundreds and hundreds of people a month. The Community Health Needs Assessment, which came out of the Affordable Care Act, has required collaboration among public health experts and other stakeholders to identify the health challenges in communities and across our country. It has forced these groups to look holistically at measures that can be taken to address the most pressing health issues facing families in these areas. And it's just one example of the positive impact the Affordable Care Act is having on our constituents. But, Mr. Speaker, if we repeal the Affordable Care Act, as my Republican colleagues are trying to do, there is no guarantee that these innovations and collaborations will continue. We need to focus on ending hunger now. With that, I yield.